Currently, the CDC requires all passengers on airplanes and other public transportation to wear masks when boarding, disembarking, and for the entire duration of travel. People must also wear a mask in transportation hubs. Leslie Manookian is president and founder of the Health Freedom Defense Fund. That is the main plaintiff in a lawsuit against the federal government over these mandates. She's also involved in other lawsuits against vaccines and mask mandates. Leslie, thanks for joining us tonight.
Thanks so much for having me.
So what is the general premise of these suits?
Well, the basic issue is that the federal government doesn't have the power to tell states or private businesses or anybody what to do, and they are overstepping their bounds. Health laws are reserved, the health powers are reserved to the states and not given to the federal government. And yet the CDC, which is not empowered to do this, is pushing these edicts on airlines, cruise lines, et cetera. And so we are trying to push back and make them follow the law.
But why politicize this? This is a basic public health measure, right? I mean, why is someone's comfort not wearing a mask more important than everyone else's health on the airplane?
I don't think it's about comfort. I think it's about a variety of things. First of all, there's a huge debate about whether or not masks actually do what health authorities claim that they do. In fact, CDC's own science shows that masks don't do what they claim. They published a study on randomized controlled trials related to how they prevented flu spread, and it didn't have any impact. That was just published last year. So what I don't understand is, why is the CDC pushing a policy that their own data doesn't support? And very importantly, I think you have to all understand is that it's not just benign. For some people, they have anxiety. Some people can't breathe very well. I struggle with a mask personally, and I know many people do. But aside from that, our face is our avatar in public. If we can't share our faces and we can't breathe properly, it's really hard for other people to read us, for our children to read us, and that's how we interact. So I think it's actually much bigger than a little tiny inconvenience.
Well, I want to back up on the science a little bit. Do you believe that more than 600,000 Americans have died of COVID?
Sure. I don't have any doubts about what the official statistics are, although I will say that I think that the tests have been very clearly demonstrated to produce a lot of false positives. There are many scientists who are debating whether or not the tests are as accurate as health authorities claim. And there are some people who say that, I think it's already admitted by the CDC that there's a difference between those who die with COVID and those who die from COVID. And if you look at those who die with COVID, it's well over 90% of the people. So there are different ways to look at this.
Okay, I think that most scientists, at least most scientists and public health experts and doctors we've talked to, would disagree that masks don't work, that that's a basic public safety measure. And, when you talk about human rights and civil rights and the rights of states, doesn't everyone else have the right to be free of COVID and to at least have passengers around them, people around them, or students in class, especially the students who aren't eligible for the vaccine? Don't they have a right to stay healthy and have a right to have the people around them take basic health precautions in a global pandemic?
Sure, but here's the thing. Do you want government telling you that you can't have ice cream because it's got sugar in it? Do you want government telling you that you can't have a big gulp because it's filled with high fructose corn syrup? Where does this end? Do you want government telling you that you have to take antidepressants because people aren't happy enough? Where does this stop? Health Freedom Defense Fund is committing to defending our rights. And we believe that there are health measures that should be catered to by government, such as not letting companies dump their chemicals into waterways and garbage in streets and things like this. But when it comes to personal issues, there are many factors that determine how healthy a person is. Most importantly, do you sleep enough? Do you eat well? Do you get exercise? These are all important things. And the fact that or the way that a person takes care of themselves is personal. And just walking around without a mask doesn't make you a vessel of disease, number one.
It is, I'm sorry to interrupt you, it is personal, but those are personal choices that affect the individual. They don't affect the entire community around them. I mean, are we also going to sue the airlines for requiring seatbelts?
Well, I think that's very, very different because it doesn't actually impede your airway, does it? And it's not an airline telling you or the CDC telling you that one, you can't breathe, and two, telling you what the science is, and three, silencing those who disagree. So there are hundreds and hundreds of doctors and scientists who have a different perspective, and they're being silenced. And the question is why? Why don't we have an open, honest debate about these issues rather than kicking them off the media, trying to get them fired from their hospitals, and big tech shutting them down? That's the real issue. So if we were having an open and honest debate about this, it would be very different, but we're not. And there's a reason for that. And federal health officials are calling on the media and big tech to silence these people. That's wrong.
Well, we appreciate you expressing your voice tonight, and we appreciate having you and you making the time for us. Thank you so much for joining us.